This is the treatment plan for Yang Tseng, loading the DICOM data here and rendering it 3D. I'm looking at the bone mesh of the upper anterior area that we're looking at, tooth number 9. Looks like the patient has a nice bone ridge in there, and if we were to put the sagittal view and just scroll the sagittal view to come to the area that we have in question, notice right here it looks like there may have been some kind of a bone graft that was done before, and there's plenty of bone to place a nice implant in there. I will proceed next to the bite registration and the segmentation process. So going through the bite registration process, notice that this is a polyvinyl bite, and the patient is not biting all the way down, and I will show you that because you cannot see through the bite, the PVS material in here. So we superimposed the maxilla, then we went ahead and superimposed the mandible, and by the time we got to actually view the articulation between the top and the bottom, the bite is actually open. So please make sure that when you take a bite next time, make sure that the patient's biting in centric occlusion so we can evaluate the interarch distance a little bit better. So moving forward, I will proceed to the segmentation process. So after segmenting the two teeth number 8 and number 10 and segmenting the roots in there, we can go ahead and actually remove the tissue, and we can actually view the actual roots that are in there that were segmented. And in various views right here, we can look at the maximum projection window, which is right here, and we can see the two roots on tooth number 8 and tooth number 10. And now we can technically take that view and just move forward and try to mirror image number 8 and position it into the number 9 position with the teeth and with the roots as well, and then position the implant to be in the optimum position in terms of the load vector based on the bite. So I will proceed to the reverse engineering process. So here we go, we went ahead and reverse engineered tooth number 9 with the actual roots and everything. I can remove the bite very quickly and show you the superimposition right there. These are the roots on tooth number 8 and tooth number 10. I went ahead and reverse engineered the entire tooth, and it's a clone, as you can see, and a mirror image of tooth number 8 that we placed on tooth number 9 right there. And then of course we also mirror image the position of the roots as well. So taking the tissue out, we can actually see the 3 teeth that are in question. These were teeth that were root canaled, and it would be ideal for future anterior cosmetic cases like this to order the final abutment with a temporary crown at the same time, because now we can actually create the healing abutment and the final abutment based on the scan of the actual root. This is a new release of the software. I just want you to be aware of it, and I'll show you how that works now. So now we can actually take the tooth that we have in question, and we can actually select tooth number 9 and mirror image that root shape that we have in question. Here we have identified the beginning and the final step that we can scan, and we can actually replicate nature. Notice this is the emergence profile of that tooth. This is the position of the implant right here. This is the area where the papilla is going to be protecting the mesial and distal area of it. And if we were to look at it over here and just remove the roots very quickly, you could see where that healing abutment could be attached. It's a bioengineered healing abutment that's replicating the natural root of the actual tooth, and this was done by scanning the root surface right here and providing exactly the identical emergence profile that the natural tooth had in there. And this can be replicated right here and placed on top of the implant right at the time of the surgery to evaluate depth papilla support, etc., etc. In fact, it's easier. You don't have to put the final abutment immediately, but you can try it at the time of the surgery, and at the time of the exposure, you can put the final abutment with a temporary crown on it, and you will be sculpting the tissue perfectly to the ideal emergence profile of the natural root next to it. So this is again a new release of the software that's very, very useful for periodontists and surgeons, and people love it because now you can pre-order the final abutment and the temporary tooth that will be a copy of the adjacent tooth in there, and you don't have to worry about human intervention in terms of fabricating a tooth in there. So I will proceed next and go to the implant planning process. So this is the integrated view with the bite and everything in here in the volume view. I will remove the opposing arch, remove the bone mesh, and remove the tissue as well, peel off, and then I will double click on the implant that was planned right in here. And this implant, as you can see, is going to be a 4.3 by 13 millimeters, and it's going to be coming right out of the facial side of the tooth. So this cannot be a screw retained restoration, because to do a screw retained restoration here, this implant technically has to be like this, and it would be perforated completely. So this has to be right in the bone, and it's going to come right off the facial side of the buccal abutment. So removing the cross slicer view very quickly and removing the roots, or the volume view for that matter, you could see where that implant has been placed. It's right in line with the actual root that was reverse engineered, placed a little bit more palatal. If we remove the roots now, you could see this is the tooth relevant to that position of the implant that's there. Now putting the cross slicer view and putting the bone view on it, this is the bone that will be traced in there, and then if we place the tissue, you could see where the tissue is going to be, and it's going to be about 3 or 4 millimeters depth for the final abutment for tissue contour. So this should conclude the treatment plan for Yan Tsang, and again we will be positioning a 4.3 by 13 millimeter implant in there for tooth number 9.